Thyroid dysfunction, an in-depth exploration. The thyroid, a small butterfly-shaped gland located at the front of your neck, plays a pivotal role in regulating metabolic processes through the hormones it produces. When this delicate balance is disrupted, it results in thyroid disease, a condition with a spectrum ranging from benign goiters to life-threatening cancer. Understanding thyroid disorders, their types, causes, symptoms, and treatments is crucial for effective management. Thyroid disease overview. The thyroid gland, a vital component of the endocrine system, orchestrates metabolic functions by secreting hormones. Disturbances in this process lead to thyroid disease, a broad term encompassing various disorders. Whether it's an excess or deficiency of thyroid hormones, the consequences can be discomforting. However, with accurate diagnosis and appropriate treatment, most thyroid issues can be effectively managed. Location and structure of the thyroid. Situated under the skin at the front of the neck, the thyroid gland is a small but influential organ. Its butterfly-shaped structure highlights its significance in regulating crucial bodily functions. Types and causes of thyroid disease. Thyroid diseases are broadly categorized into hyperthyroidism and hypothyroidism, both influenced by underlying conditions affecting the thyroid gland. Hyperthyroidism. Graves' disease, characterized by excessive thyroid hormone production. Toxic adenomas, nodules in the thyroid disrupting hormone balance. Subacute thyroiditis, inflammation causing temporary hyperthyroidism. Pituitary gland malfunctions or thyroid cancer, rare cases leading to hyperthyroidism. Hypothyroidism. Hashimoto's thyroiditis, an autoimmune disorder causing thyroid tissue destruction. Postpartum thyroiditis, occurs after childbirth or pregnancy loss. Iodine deficiency, a global issue affecting hormone production. Thyroid removal or exposure to excessive iodine, surgical or chemical interventions. Lithium use, linked to hypothyroidism. Untreated hypothyroidism can lead to myxedema coma, a potentially fatal condition. Newborns and infants are particularly vulnerable, as thyroid hormone deficiency can result in intellectual disability and stunted growth. Environmental factors. In addition to genetic predispositions, environmental factors can contribute to thyroid problems. Exposure to certain environmental pollutants, such as endocrine disrupting chemicals, may influence thyroid function. Research is ongoing to understand the intricate interplay between environmental factors and thyroid health. Autoimmune conditions. Individuals with a history of autoimmune disorders, such as rheumatoid arthritis, lupus, or type 1 diabetes, face an elevated risk of developing thyroid issues. Autoimmune diseases involve the immune system mistakenly attacking the body's own tissues, including the thyroid, leading to disorders like Hashimoto's thyroiditis. Medication-induced thyroid dysfunction. Certain medications can disrupt thyroid function. For instance, drugs containing iodine, such as amiodarone used for heart conditions, can impact thyroid hormone production. Additionally, lithium, a medication prescribed for psychiatric conditions, has been linked to hypothyroidism. Age and gender disparities. Age and gender play significant roles in thyroid health. Women, in particular, are 5 to 8 times more likely than men to be diagnosed with thyroid issues. Moreover, individuals aged 60 and older face an increased susceptibility, possibly due to the cumulative effects of aging on the thyroid gland. Previous thyroid conditions. A history of thyroid problems, whether hyperthyroidism or hypothyroidism, increases the likelihood of future thyroid issues. Individuals who have undergone thyroidectomy, surgical removal of the thyroid, or have received radiation treatment to the head and neck region may have an elevated risk, emphasizing the importance of ongoing monitoring. Thyroid cancer and nodule presence. The presence of thyroid nodules, although often benign, can increase the risk of thyroid cancer. Individuals with one or more nodules may undergo long periods without symptoms before a diagnosis is made. Regular checkups and monitoring become crucial for those with thyroid nodules, especially if there is a history of radiation exposure. Pernicious anemia and other associations. Certain medical conditions, such as pernicious anemia and Turner syndrome, are associated with an increased risk of thyroid problems. Pernicious anemia, an autoimmune condition affecting the absorption of vitamin B12, has been linked to autoimmune thyroid disorders. The complex interplay of risk factors. Understanding the complex interplay of these risk factors is essential for healthcare professionals to tailor diagnostic and preventive approaches. Genetic susceptibility, combined with environmental exposures and individual health history. contributes to the multifaceted nature of thyroid problems. Ongoing research aims to unravel the intricate connections between these factors, providing a more nuanced understanding of thyroid health and paving the way for personalized interventions. As our knowledge deepens, healthcare practitioners can refine risk assessments and develop targeted strategies to mitigate the impact of thyroid disorders on individuals and communities. Symptoms of thyroid dysfunction. Thyroid dysfunction manifests differently depending on whether the thyroid is overactive, hyperthyroidism, or underactive, hypothyroidism. Hyperthyroidism symptoms. Excessive sweating. Individuals with hyperthyroidism often experience increased perspiration, even in normal temperature conditions. Irregular heartbeat. The overproduction of thyroid hormones can lead to a rapid or irregular heartbeat, known as palpitations. Unintentional weight loss. Despite maintaining regular eating habits, hyperthyroidism may result in unintended weight loss. Protruding eyes. A condition known as exophthalmos, where the eyes appear to bulge outwards, is a distinctive sign of hyperthyroidism. Nervousness. Individuals may feel restless, anxious, or excessively nervous, reflecting the heightened metabolic state. Hypothyroidism symptoms. Tiredness. Hypothyroidism often leads to persistent fatigue, even after adequate rest, impacting daily activities. Weight gain. Individuals with hypothyroidism may experience unexplained weight gain, often attributed to a slowed metabolism. Depression. Changes in thyroid hormone levels can affect neurotransmitters, contributing to feelings of sadness or depression. Abnormal bone development. In cases of prolonged hypothyroidism, bone health may be compromised, leading to issues such as joint pain and stiffness. Stunted growth in infants. Newborns and infants with untreated hypothyroidism may exhibit developmental delays, including stunted growth. Early signs of thyroid disease. Changes in temperature tolerance. Individuals may notice a shift in their sensitivity to hot or cold temperatures. Menstrual cycle changes. Women may experience irregularities in their menstrual cycles, including changes in flow or frequency. Energy level and mood shifts. Fluctuations in thyroid function can impact energy levels and mood, leading to periods of lethargy or irritability. Weight fluctuations. Unexplained changes in weight, whether gain or loss, can signal thyroid dysfunction. Comprehensive impact on the body. Thyroid disorders exert a profound influence on various bodily functions, underscoring the importance of comprehensive management. Heart rate. Thyroid dysfunction can disrupt the normal rhythm of the heart, affecting cardiovascular health. Mood. Imbalances in thyroid hormones can contribute to mood swings, anxiety, and even depression. Energy levels. The thyroid regulates metabolism, impacting overall energy levels and vitality. Metabolism. An altered metabolic rate can lead to weight changes, impacting overall health. Bone health. Prolonged thyroid dysfunction, especially hypothyroidism, may affect bone density and contribute to musculoskeletal issues. Pregnancy. Thyroid disorders can influence fertility, pregnancy outcomes, and the health of both the mother and the developing fetus. Diagnosis of thyroid disease. Diagnosing thyroid disease poses challenges due to the overlap of symptoms with various other conditions. However, a combination of precise diagnostic tools and thorough examinations enables healthcare professionals to accurately identify and assess thyroid dysfunction. Blood tests. Blood tests are among the most reliable methods for diagnosing thyroid disorders. These tests measure the levels of thyroid hormones, T3 and T4, and thyroid-stimulating hormone, TSH, in the blood. Elevated or reduced hormone levels can indicate hyperthyroidism or hypothyroidism, respectively. Additionally, antibody tests help diagnose autoimmune thyroid conditions, such as Hashimoto's thyroiditis or Graves' disease. Imaging tests. Thyroid scan. This imaging test involves the administration of a small amount of radioactive material, which allows visualization of the thyroid gland using a special camera. It helps identify the size, shape, and function of the thyroid, aiding in the diagnosis of conditions like nodules or inflammation. Ultrasound. Ultrasound imaging uses sound waves to create a detailed image of the thyroid gland. It helps identify the presence of nodules, cysts, or abnormalities in the thyroid structure. Physical exams. A physical examination by a healthcare professional includes palpating the neck to check for any enlargement, nodules, or irregularities in the thyroid gland. The examination assists in identifying visible or palpable signs that may prompt further diagnostic investigations. Iodine uptake tests. For cases suspected of iodine deficiency or when hypothyroidism is being evaluated, an iodine uptake test may be conducted. This test tracks the amount of iodine absorbed by the thyroid, providing insights into thyroid function. Iodine is a crucial element for thyroid hormone production, and deficiencies can impact thyroid health. At-home thyroid check. A simple and preliminary at-home check involves observing the thyroid while swallowing water in front of a mirror. The steps include locating the thyroid on the front of the neck, between the collarbone and Adam's apple. Tipping the head back and swallowing water while watching the thyroid. Looking for any visible lumps or bumps, which may indicate the presence of nodules or abnormalities. Challenges in diagnosis. Symptom overlap. The symptoms of thyroid disorders can mimic those of other medical conditions, making it challenging to pinpoint thyroid dysfunction solely based on symptoms. Subtle symptoms. In some cases, thyroid dysfunction may present with subtle symptoms or be asymptomatic, necessitating comprehensive diagnostic approaches. Complexity of autoimmune conditions. Autoimmune thyroid disorders, such as Hashimoto's or Graves' disease, often require specialized antibody testing for accurate diagnosis. Thyroid disease treatment. The approach to treating thyroid disease is tailored to the specific type and underlying cause of the condition. Various treatment modalities are employed to address hyperthyroidism, hypothyroidism, and thyroid cancer. Hyperthyroidism treatment. Radioactive iodine treatment. Mechanism. Involves the ingestion of radioactive iodine, which selectively damages thyroid cells, leading to a reduction in hormone production. Purpose. Used to control the overactive thyroid by intentionally impairing thyroid function. Considerations. May result in the development of hypothyroidism over time, necessitating ongoing monitoring and thyroid hormone replacement. Antithyroid medication. Mechanism. Medications like methimazole or propylthiouracil work to inhibit the production of thyroid hormones. Purpose. Slows or stops the excessive production of thyroid hormones in conditions such as Graves' disease. Considerations. Continuous medication management is often required, and side effects may occur. Surgery. Procedure. Surgical removal of the thyroid gland, thyroidectomy, is considered in certain cases, especially when medications or radioactive iodine are not suitable. Purpose. Eliminates or significantly reduces thyroid hormone production. Considerations. Requires lifelong thyroid hormone replacement therapy post-surgery. Hypothyroidism treatment. Thyroid hormone replacement. Medication. Levothyroxine, a synthetic form of the thyroid hormone, is prescribed to supplement deficient hormone levels. Purpose. Restores thyroid hormone levels to normal, addressing symptoms associated with hypothyroidism. Considerations. Regular monitoring and adjustments in medication dosage may be necessary to maintain optimal hormone levels. Thyroid cancer treatment. Thyroidectomy. Procedure. Surgical removal of cancerous tissue or the entire thyroid gland. Purpose. Eliminates cancerous cells and prevents the spread of thyroid cancer. Considerations. Post-surgery, thyroid hormone replacement is often required, and follow-up monitoring is crucial. Alternative treatment approaches. Some individuals explore alternative therapies, such as naturopathy or chiropractic care, to complement conventional treatments. However, it's essential to note that limited scientific evidence, while alternative therapies may help manage stress associated with thyroid disease, their effectiveness in treating the core thyroid disorders is not well supported by robust scientific evidence. Collaboration with healthcare providers. Individuals considering alternative treatments should consult with their healthcare providers to ensure compatibility with conventional treatments and to avoid potential conflicts or adverse interactions. Thyroid diet recommendations. A well-balanced and nutrient-rich diet plays a crucial role in supporting thyroid function. Incorporating specific nutrients can help maintain optimal thyroid health, while caution is advised regarding certain products that may impact thyroid function negatively. Nutrients that support thyroid function. Protein. Role. Protein is essential for the synthesis of thyroid hormones, including lean sources of protein, such as poultry, fish, beans, and tofu, supports thyroid function. Calcium. Role. Calcium is vital for the proper functioning of the thyroid gland. Dairy products, leafy green vegetables, and fortified plant-based milk are good sources of calcium. Magnesium. Role. Magnesium contributes to the conversion of the inactive thyroid hormone, T4, to the active form, T3. Nuts, seeds, whole grains, and green leafy vegetables are magnesium-rich foods. Iodine. Role. Iodine is a key component of thyroid hormones. Seafood, seaweed, dairy products, and iodized salt are sources of iodine. However, excessive iodine intake should be avoided. B vitamins. Role: B vitamins, particularly B12 and B6, play a role in thyroid function. Meat, fish, poultry, dairy, and fortified cereals are good sources of B vitamins. Vitamin A. Role: Vitamin A is essential for the synthesis of thyroid hormones and supports overall thyroid health. Carrots, sweet potatoes, spinach, and eggs are rich in vitamin A. Vitamin C. Role: Vitamin C acts as an antioxidant, supporting immune function. Citrus fruits, strawberries, bell peppers, and broccoli are excellent sources of vitamin C. Cautionary considerations. Pseudoephedrine. Caution: pseudoephedrine, commonly found in over-the-counter cold remedies and decongestants, can potentially interfere with thyroid function. Individuals with thyroid disorders should use such medications cautiously and under the guidance of a healthcare professional. Alkaloids. Caution: alkaloids, including caffeine, morphine, and quinine, found in various substances, may influence blood pressure and heart rate. Monitoring caffeine intake and avoiding excessive use of products containing alkaloids is advisable for individuals with thyroid concerns. General dietary tips for thyroid health. Balanced diet. Ensure a well-balanced diet that includes a variety of nutrient-dense foods from different food groups. Moderation in iodine intake. While iodine is crucial for thyroid function, excessive intake can be detrimental. It's important to maintain a balance and avoid unnecessary iodine supplementation. Regular monitoring. Individuals with thyroid disorders should work closely with healthcare professionals to monitor nutrient levels and make adjustments to their diet or supplementation as needed. Hydration. Staying adequately hydrated is essential for overall health, including thyroid function. Individualized approach. Dietary needs can vary among individuals, and an individualized approach, considering specific health conditions and requirements, is recommended. Your health matters. Quali.health